Guillain-Barré Syndrome. Introduction. Guillain-Barré Syndrome, GBS, is a rare but serious autoimmune disorder in which the body's immune system attacks the peripheral nervous system, leading to muscle weakness, sensory disturbances, and, in severe cases, respiratory failure. It is characterized by acute, progressive, and ascending paralysis, often following a viral or bacterial infection. The exact cause of GBS remains unclear, but it is believed to be triggered by an immune response that mistakenly targets the myelin sheath of peripheral nerves. Definitions. According to the World Health Organization, Guillain-Barré syndrome is a rare neurological disorder in which the body's immune system attacks the peripheral nerves, leading to progressive muscle weakness and, in severe cases, respiratory failure. According to the National Institute of Neurological Disorders and Stroke, NINDS, GBS is an acute inflammatory demyelinating polyneuropathy characterized by rapid onset muscle weakness caused by the immune system damaging the peripheral nervous system. Risk factors. Infectious factors. These factors involve prior bacterial or viral infections that may trigger an abnormal immune response, leading to GBS. Campylobacter jejuni infection, the most common bacterial trigger of GBS. This bacterium causes gastrointestinal infections, and its surface antigens mimic components of nerve cells, leading to an immune attack on the nervous system, molecular mimicry. Epstein-Barr virus, EBV, a herpes virus that causes mononucleosis. It can trigger immune system overactivity, leading to nerve damage. Cytomegalovirus, CMV, another herpes virus that can cause neurological complications and has been linked to post-infectious GBS. Influenza virus, flu infections can lead to immune dysregulation, increasing the risk of GBS development. Recent respiratory or gastrointestinal infections, many cases of GBS occur after common colds, flu, or food poisoning, which provoke an immune response that mistakenly attacks the nerves. Non-infectious factors. GBS may also occur due to non-infectious factors that trigger immune system dysregulation. Recent vaccination, rare cases vaccines, such as influenza or COVID-19 vaccines, have been rarely associated with GBS due to an exaggerated immune response. However, the risk is extremely low, and the benefits of vaccination generally outweigh this minimal risk. Post-surgical immune response. In some cases, major surgeries may alter immune system function, potentially leading to autoimmune conditions like GBS. Autoimmune disorders. Individuals with pre-existing autoimmune diseases, such as lupus or rheumatoid arthritis, may have a higher likelihood of immune system dysregulation that could lead to GBS. Environmental and lifestyle factors. Certain demographic and genetic factors influence the risk of developing GBS. Older age, higher risk in individuals over 50. The immune system becomes less regulated with aging, increasing susceptibility to autoimmune reactions that lead to GBS. Male gender, higher prevalence in males. Men are more frequently affected by GBS than women, though the exact reasons remain unclear. Hormonal or genetic factors may play a role. Genetic predisposition, family history of autoimmune diseases. Although GBS is not directly inherited, individuals with a family history of autoimmune diseases may have a genetic predisposition to immune system dysfunction, making them more susceptible to developing GBS. Etiology. GBS is primarily caused by an abnormal immune response that mistakenly attacks the peripheral nervous system. This can be triggered by infections, vaccinations, or other external factors, leading to nerve inflammation, demyelination, and in severe cases, axonal damage. Post-infectious GBS is the most common form of the disease and typically occurs after a bacterial or viral infection. Infections such as Campylobacter jejuni, a bacterial cause of food poisoning, Epstein-Barr virus, cytomegalovirus, and influenza virus have been strongly linked to GBS. The infection triggers an immune response, but instead of only attacking the pathogen, the immune system mistakenly targets components of the peripheral nerves, especially the myelin sheath and, in some cases, the nerve axons. Autoimmune-mediated GBS occurs when the immune system becomes dysregulated and starts producing antibodies that attack Schwann cells, which are responsible for producing myelin, or directly attack the axons of peripheral nerves. This results in demyelination, slowing or blocking nerve signal transmission, which leads to muscle weakness, paralysis, and sensory loss. In more severe cases, it can cause axonal degeneration, leading to longer recovery times and the potential for permanent nerve damage. Molecular mimicry is a process where foreign antigens from bacteria or viruses closely resemble structures in nerve cells. When the immune system attacks these invaders, it mistakenly targets similar components in the nervous system, such as gangliosides, lipid molecules found in nerve cell membranes. This cross-reaction results in nerve inflammation and damage, causing the classic symptoms of GBS. A key example is Campylobacter jejuni, which produces antigens that mimic gangliosides in peripheral nerves, leading to antibody-mediated nerve damage. Types: acute inflammatory demyelinating polyneuropathy, AIDP, is the most common type of Guillain-Barré syndrome. It begins with muscle weakness in the legs and gradually spreads upward to the upper body and arms. This occurs because the immune system mistakenly attacks the protective covering of nerves, myelin sheath, slowing down nerve signals. As a result, individuals experience weakness, numbness, and sometimes paralysis. With proper treatment, recovery is generally favorable. Miller-Fisher syndrome, MFS, is a rare variant of GBS, making up about 5 to 10% of cases. Unlike AIDP, it primarily affects the head and face rather than the limbs. It is characterized by eye muscle paralysis, ophthalmoplegia, poor coordination, ataxia, and the loss of reflexes, areflexia. The condition is strongly linked to anti-GQ1b antibodies, which target nerve structures responsible for eye movement. While symptoms can be concerning, the prognosis is usually good, with gradual recovery over weeks to months. Acute motor axonal neuropathy, AMAN, is more common in Asia, Central and South America, and China. It primarily affects motor nerves, leading to severe muscle weakness without sensory loss. AMAN is strongly associated with Campylobacter jejuni infection and occurs due to molecular mimicry involving anti-GD1 antibodies. Unlike AIDP, which affects the nerve's protective covering, AMAN involves direct damage to the nerve fibers, axonal degeneration, which can result in a longer or incomplete recovery. Acute motor sensory axonal neuropathy, AMSN, is a more severe variant of AMAN that affects both motor and sensory nerves. It causes rapid muscle weakness, loss of sensation, and severe autonomic dysfunction. This form of GBS results in more extensive nerve damage, leading to longer recovery times and a higher risk of lasting disability. AMSN is often linked to severe infections, especially those caused by Campylobacter jejuni. Due to the significant nerve damage, recovery can be prolonged and sometimes incomplete. Pathophysiology. Infectious trigger or immune activation, example Campylobacter jejuni, viral infections, vaccines, etc. Down arrow. Immune-mediated attack on peripheral nerve myelin proteins. Down arrow. Inflammation and demyelination of peripheral nerves. Down arrow. Disrupted nerve conduction leading to weakness and sensory deficits. Down arrow. Progression to respiratory and autonomic dysfunction in severe cases. Down arrow. Gradual recovery with remyelination or persistent axonal damage. Clinical manifestations. Muscle weakness starting in lower limbs, progressing upwards, ascending paralysis. Diminished or absent deep tendon reflexes, hyporeflexia. Paresthesia, numbness/tingling, in hands and feet. Bulbar muscle involvement leading to swallowing difficulties. Respiratory muscle weakness, potentially requiring mechanical ventilation. Cranial nerve involvement causing vision problems, facial weakness, and dysphagia. Autonomic dysfunction, including blood pressure instability, cardiac arrhythmias, and bladder dysfunction. Diagnostic evaluation. History taking. Recent infections, vaccinations, or illnesses. Onset and progression of muscle weakness. Physical examination. Reflex testing, absent or diminished deep tendon reflexes. Cranial nerve assessment, facial and swallowing muscles. Laboratory and imaging tests. Lumbar puncture, CSF analysis, elevated protein with normal white blood cell count. Electromyography, EMG, and nerve conduction studies, NCS detects nerve damage and demyelination. Blood tests, to rule out other causes, autoimmune disorders, infections. Medical management. Plasmapheresis, removes circulating antibodies, reducing immune-mediated damage. Intravenous immunoglobulin, IVIG, neutralizes harmful antibodies, equally effective as plasmapheresis. Mechanical ventilation, required if respiratory muscles are compromised. Thromboprophylaxis, heparin and compression stockings to prevent deep vein thrombosis, DVT. Pain management, analgesics and gabapentinoids for neuropathic pain. Blood pressure and heart rate monitoring, medications for autonomic dysfunction. Surgical management. No direct surgical intervention, treatment is primarily medical and supportive. Dietary management. High protein, nutrient-rich diet to support muscle recovery. Omega-3 fatty acids to reduce inflammation. Adequate hydration and electrolyte balance for overall health. Nursing management. Assessment. Frequent monitoring for progression of weakness and respiratory failure. Vital signs and neurological assessments to detect complications. Emotional support to manage patient and family anxiety. Nursing diagnoses. Ineffective breathing pattern related to progressive muscle weakness. Impaired physical mobility related to paralysis. Imbalanced nutrition, less than body requirements related to difficulty swallowing. Impaired verbal communication related to facial and bulbar weakness. Fear and anxiety related to sudden paralysis and uncertain prognosis. Nursing interventions. Maintaining respiratory function. Monitor respiratory rate, oxygen saturation, and vital capacity. Initiate mechanical ventilation if respiratory failure is imminent. Perform suctioning for secretion clearance in bulbar involvement. Enhancing physical mobility. Passive range of motion exercises to prevent contractures. Positioning to prevent pressure ulcers and DVT. Physiotherapy and rehabilitation post-acute phase. Providing adequate nutrition. Assess swallowing function, initiate enteral feeding if necessary. Monitor weight and hydration status. Improving communication. Use communication boards or blink response systems. Collaborate with speech therapy for alternative communication strategies. Managing fear and anxiety. Provide psychological support and education on recovery. Encourage family involvement in care and decision-making. Monitoring and managing complications. Respiratory failure, monitor vital capacity and early signs of distress. Autonomic dysfunction, watch for fluctuations in heart rate and blood pressure. Deep vein thrombosis and pressure ulcers, prevent with mobility aids and compression therapy. Prevention. Prompt treatment of respiratory and gastrointestinal infections. Cautious administration of vaccines in at-risk individuals. Avoidance of known triggers, such as Campylobacter contaminated food. Early recognition of symptoms for immediate intervention. Maintaining good overall immune health with balanced nutrition and hydration. Potential complications. Respiratory failure requiring prolonged ventilation. Autonomic dysfunction leading to cardiovascular instability. Deep vein thrombosis and pulmonary embolism due to immobility. Chronic pain and fatigue in post-recovery phase. Permanent weakness in severe cases.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.